Hello, welcome everybody to today's live stream. We will be getting started at 11, so we're just going to give everybody some time to get in. I am going to add med school. Dr. Fish joining us very, very shortly. Hello.
Hello.
Can you hear me okay?
I can. Can you hear me okay?
I can hear you just fine. That's my number one concern. You know, as cats and children start coming in.
Yes.
For everybody joining today, we will get started in 1 minute's time. And obviously we are doing this remotely. So if somebody's internet cuts out, or if a cat or a young child comes in from my end, please excuse that. But we will just give everybody a few more moments to get in. That was actually, Dr. Fish, the smoothest entrance I think we've ever had on Instagram Live. So congratulations. And I can see and I can see others are joining now, and I can see that we can get started. So for everybody here, I'm Ed Bottomley from the Michigan Medicine Department of Communication, and welcome to our Instagram live chat with Dr. Angela Fish, Training Director of the Child and Adolescent Psychology Practicum and Fellowship Programs at the University of Michigan. So Dr. Fish, thank you so much for joining us today.
Thank you for having me.
Before we begin, just a little bit of housekeeping. I want to mention that my colleagues are monitoring the comments on the chat to look for questions, and we'll try to ask some of those later in the discussion. If someone would prefer to ask a question by email, they can write to ask-mishmed@med.umich.edu. That's ask-mishmed@med.umich.edu. And once again, we'll be monitoring the inbox and the comment section throughout the chat. This chat is probably going to last about 20 to 30 minutes, and a recording of it will be available afterwards. We're also planning a follow-up story on this on our health blog. So have a look on our Michigan Medicine Instagram account and have a look on our bio for the links next week. So that's pretty much all of the admin I have. Dr. Fish, thanks again for joining us. One of your areas of interest is studying the autism spectrum disorder. The Autism Speaks organization recognizes April as World Autism Month, and we're hoping that you can shed some light on some commonly asked questions around autism spectrum disorders. So the first one I have for you is, what is the autism spectrum?
So historically, the autism spectrum was considered to be a group of disorders that were characterized by challenges in social communication and a pattern of restricted or repetitive interests or behaviors. With the publication of the DSM-5, the DSM is the sort of psychiatric diagnostic manual. So the DSM-5 was published a few years ago, and that changed the diagnostic system a little bit for autism and lumped all of those diagnoses into the autism spectrum. So there used to be Asperger's disorder, autism, PDD-NOS, amongst others. And now we've lumped them all into one category called the autism spectrum. The thing I like about that is that calling it a spectrum, I think is good, because it really reflects that there's lots of different strengths and weaknesses and lots of different dimensions that are characteristic of the autism spectrum.
Yeah, thank you for that, Dr. Fish. Next question I have for you is, autism or an autism spectrum disorder always diagnosed in young children, or can it be diagnosed in adolescents or perhaps even adults?
So yes, it definitely can be diagnosed anywhere at any age. Ideally, we are diagnosing kids as young as possible because we know that early intervention is important. So we want to diagnose kids as early as possible, but I've certainly diagnosed, 50, 60-year-old adults as well.
Yeah, that's really interesting. Next question we have for you is, are autism spectrum disorders genetic? If I'm on the autism spectrum, does that mean that my child could likely be too?
So the short answer is yes, that autism is genetic, but also that having autism doesn't mean that for sure your child is also going to have autism. The likelihood is greater, but it's not a one-to-one correlation either. So we know that in monozygotic twins, so identical twins who share 100% of their genetics, there's a 70 to 90% concordance rate or likelihood that, you know, they both will have, if one has autism, the other will also have autism. So it's still not 100%, even with completely shared genetics. And obviously a parent is only sharing half their genetics with their child.
Yeah, that's fascinating. Is the next question touches on this in a different way. Is there a link between DNA and autism or autism spectrum
Yes.
disorders?
So there are several known genetic conditions that are related to autism, and also, you know, many identified DNA copy number variations and chromosomal deletions or duplications that are related to autism that we know about already.
Thanks. It looks like we have a question coming in. What's the earliest age you would evaluate for and diagnose autism spectrum disorder?
That's a great question. We know we can very reliably diagnose as young as 2, and really once a child is walking, I've done evaluations with 1-year-olds before, and we're not necessarily at that point going to give a like very firm, we're 100% convinced diagnosis at 1, but we do sometimes give provisional diagnoses at that age so that kids can get into early intervention services right away. So as soon as parents are concerned, they should bring it up to their pediatrician. And if they're really concerned, insist on getting that diagnostic evaluation.
Thank you. I think that's a really important point you made there. Let's talk about, for our next question, external causes of autism. Are there any external causes of autism?
So I mean, the short answer to that is we don't know enough. Right? Like there's still so much more work to be done. We know that the risk for an autism diagnosis is higher for older parents, older moms and older dads, that can be a risk for a higher likelihood for a diagnosis. Certainly, you know, there are likely environmental toxins and viral infections and things that may be linked, but we just don't know, and pregnancy and birth complications. But there's also lots of times that we know those things happen and autism doesn't happen. So it's certainly not a one-to-one correlation. There's some combination of kind of genetic risk that might be there combined maybe with an external cause.
Yeah, thank you for that. And this has been touched on, but I think it absolutely bears repeating. We're getting a request to elaborate. Does early intervention make a difference with autism spectrum disorder?
Yes, 100%. You know, young brains are so malleable, right? Their little kids' brains are constantly forming those connections, and if we can intervene early and help them understand and realize that social connectedness and pique their interest in what other people are doing, so that they're trying out, they're imitating what they're seeing other kids do, and trying those out and seeing if that works for them or doesn't work for them. And they're interested in playing with their parents and getting involved in things that if we can pique that early on, their brains are developing those connections so much stronger, versus, you know, if kids are really isolated in their own worlds early on like that, they're not building those connections that are going to help them build language skills and make good eye contact and do all the things that we want them to do ultimately in social communication.
I think that's fantastic. You know, as a dad of 5 myself, I know that all my kids are very different. You know, each one is delightfully different, you know, as they were growing up. But when you talk about areas for concern, when you talk about parents, if they're truly concerned, to insist on a test, what kind of things should parents be perhaps looking for?
So definitely things like, you know, limited eye contact, not having a lot of back and forth sharing of, in infants, we expect that they're going to be sharing smiles and trying to kind of have little conversations, even in noises, back and forth with their parents, and sharing those facial expressions, and trying to imitate the expressions their parents are making. We want them to be babbling early on, right? And certainly around a year to be starting to use words. And if those sorts of things aren't happening, we want them to be bringing those up. Gestures too, right? Pointing at things and showing things are important. And then those are sort of the social communication things. And then those more of the restricted and repetitive behaviors might be repetitive movements. Young kids sometimes do have motor overflow and may engage in some flapping behavior, and that doesn't necessarily mean autism, but if parents are seeing a lot of those repetitive motor behaviors in their kids, they should bring that up to their pediatrician. If their kids have very restricted interests and only want to play with toys in a certain way, or have trouble changing their routines or changing from one activity to another, a lot of the time, then we want them to be bringing those concerns up.
Yeah, thank you, and I appreciate all the questions that have been rolling in. A few of them are similar to the questions that we've already answered. I always have a question for our experts. We've had all these questions come in. Are there any ones that you think we've perhaps missed? Are there any things that you'd like for us to touch on?
Well, I would encourage families that do have a diagnosis to get involved in research studies that we have going on, both locally and also there's, nationally even, because we don't know enough, right? We don't know enough about, we know there's this genetic cause, but then there's times where we don't have any findings yet that tell us that, that why autism might be happening, if there isn't a family history, or if there isn't, there haven't been any of these things that we do know about. Then even more important that families participate in research. So we have a study, the SPARK study, that is collecting saliva samples from both children or even adults, and anybody of any age who has autism, and their biological parents. And we're trying to figure out more about the genetic causes, but enrollment in that study also can mean that you're in a database and you're willing to be contacted for other studies. So sometimes that might be treatment studies that are going on, or different interventions and different kinds of things, so that we do learn more about causes of autism and treatments and interventions, just to help people live their best possible lives and be the best them they can be.
Absolutely. And it looks like we have a number of other questions coming in. Let's see. I have heard that certain dietary modifications, like avoiding sugar or gluten, may positively impact patients on the autism spectrum. Is there any evidence to support this? So
there aren't any large scale studies that this makes a big difference for many children with autism, or most children with autism. There certainly are case studies and anecdotal sort of reports of how that made a big difference for an individual child. So if parents are, sort of wondering about this and they're interested in trying out, I always recommend that they do a very careful sort of AB design study with their individual child, where they take really careful data about their child's functioning before changing the diet. So, and working with a treatment provider to talk about what for their specific child they should be monitoring is helpful. But then trying the diet, taking that same data while they're trying the diet, see if there's any changes. And then taking the diet away, right? Going back to usual, whatever they would do if they weren't trying to change something, and taking that data for a third time and seeing, was it really, if they did see changes with the diet, was it really the diet that made that change, right? Or is it, I mean, children develop and grow over time. So we expect that they're going to be making some changes, right? And so we want to know that that is really what's happening, because there's also side effects of using those kinds of diets, right? There's nutrients kids aren't getting if they're restricting their diet in some way. I mean, minimizing sugar is probably not bad for any of us. But certainly, you know, taking and taking sort of like chemicals and stuff out of the diet, again, probably good for most of us. But if you're taking out a significant nutrient source, like the gluten-free, casein-free diets, so, you know, if you're not having any dairy and taking out calcium, kids can break bones, right? Because they're not getting as much calcium. There's lots of other potential side effects, and it's just hard to do. So you want to know that if you're going to put the effort in, it's worth it. It's working. It's worthwhile.
Yeah, absolutely. I'm so happy with all these questions we're getting coming in for you. The next question we have is, what is Asperger's syndrome, and is it the same as autism?
So, like historically, the difference between autism and Asperger's disorder really lied in timing of language development. So kids who were not, you know, had a language development that sort of was on a typical developmental trajectory. They were speaking, you know, in phrases at 2 sentences later, you know, they were didn't have any delays in language. They may get a diagnosis of Asperger's disorder, but kids who had a language delay would get a diagnosis of autism. Part of the reason that the spectrum was collapsed, and we're just call it the autism spectrum now, is that plenty of those kids who had a language delay at 2 then caught up in language. And if you were to look at the 2 different kids at 16, 18, 25, whatever, you wouldn't necessarily be able to tell a significant difference. And so that's why they got collapsed into one diagnostic, you know, thing. Who knows what will happen in the future, right? We may be able to understand more, and maybe we'll go back to splitting things up again. But right now, it's all kind of considered to be one thing.
Sure. Yeah, and that makes sense. And we have a question about Rett syndrome. Is Rett syndrome an autism-related disorder?
So it is no longer under the autism category in the DSM-5, and I think would have gotten taken out even if we still had PDD, NOS, and Asperger's and everything. Rett syndrome was going to get taken out because there's a very specific gene that's linked with the X chromosome that is involved with Rett's. Some of the characteristics are the same as autism. And we can see regression sometimes in autism where kids were able to do something and then stopped being able to do that, stopped speaking for a short time, or became more socially withdrawn for a while. That does happen in autism, and that is what happens in Rett's. But there's a lot of times for Rett's that's recovered in a way that it's not always with autism, or not often with autism. And there's a lot of other complications with Rett's that is very specific to Rett's. So it's no longer considered to be part of the autism spectrum, even though there are some shared features for a while.
Sure. Thank you for explaining that as well. The next question we have is a broad question. What treatments are available?
So there are lots of treatments available. The treatment that's probably the most, the one that we talk about the most, is ABA, Applied Behavioral Analysis. And that's a very broad umbrella term. That means lots of different things. But the basics of it is that we're really paying attention to antecedents of a child's behavior, we're paying attention to what their behavior is, and trying to increase behaviors that we want to see more of and decrease behaviors that we want to see less of by paying attention to the antecedents, what happens before the behavior, and the consequences, what happens after the behavior. And doing that in a really systematic way. And that is, and you know, the goal to build those social communication skills and to decrease any of the restricted or repetitive behaviors that might be getting in the way of kids doing other things. And then speech therapy, occupational therapy, physical therapy, psychotherapy, psychiatric medications for any comorbid difficulties that might also be going on are all important aspects of treatment.
Thank you. Thank you for giving us a nice broad answer on that. Next question we have up, what type of autism research is currently going on at the University of Michigan? And can I enroll my child in a trial or a study?
Yes. So like I was saying earlier, the Spark study is available. I should have pulled up the website for that ahead of time so I could tell you exactly what the website is.
You know what, we can, Dr. Fish, we can add the link afterwards. We'll throw that link in afterwards. But I'm sure Googling it would help too,
yes.
If somebody wanted to do that.
Yeah, and there's other studies. I know in pediatrics, there's a study called the CAPES study, CAPES, that's going on. That's also a one that I would recommend people participate in, and it's very easy to participate in. Certainly, if you Google or look at the research participant database and search for autism, you're going to find others as well. The one I'm most involved in is the Spark study, but there's always other studies happening around the university, so I would recommend checking those out.
Fantastic. And one of our communicators just sent me the Spark link, so we can put that in the comments section after the fact. Fantastic. It looks like we have so many different ways to people asking questions, and there's actually a way to sort of privately ask me a question too. So let's see. This is a question here that we have, and it's gonna pop up on the screen as well. When working with parents with a new diagnosis of an ASD, what do you see as the key information to discuss, and how do you approach these scenarios?
So I think first and foremost, providing some support around coping with this new information and helping parents care for themselves during this time, because if you're not taking care of yourself as a parent, you're not going to be able to take good care of your kids either. So that's sort of first and foremost, do the things that are going to help you as a parent fill your cup up so you can spill it over to your kids and help them, right? So that's the first thing. I also always recommend, in terms of finding interventions, I always recommend the Autism Alliance of Michigan is a great resource for finding those treatment providers in your area, because they have a navigator program and a really strong database that has lots of information about providers that can be really helpful. And we do groups for parents of young kids who are newly diagnosed with autism, and there's a lot of good resources out there that are helpful for parents, especially, of any age, but also young kids. There's a website, helpisinyourhands.org, that's free and gives lots of good recommendations about ways parents can interact with their kids, their young kids with autism, to be able to do the things that are going to help build those social communication skills.
Thank you. Thank you so much for that question. And Dr. Fish, thank you for answering that. We have a lot of different ways for people to fire questions at us happily. The next question that we have that's come in said, you said the Spark study involves DNA collection. How do you do that?
Sorry about that. I have a limit on my social media for the day, and it just
Oh my gosh, I wish I could put such a limit on, but as the social media manager here at Michigan Medicine, it would cut off after about 2 minutes. I can absolutely repeat that question for you. So the question says, you said the Spark study involves DNA collection. How do you do that?
Yeah, that's a really good question. It's actually a really simple process. There's some forms you fill out online. They will mail you a kit, and we're taking saliva or spit samples. So there's videos and lots of good directions about how to get those, the best way to get the saliva samples, but it's really just collecting saliva samples, putting them back in the box, and mailing them off. So it's a really easy way of participating in research.
Perfect. Well, thank you so much. I know that we've had a number of different questions. I know that this is going to not be the start. This absolutely is going to be worked into a blog post, and we'll have this up on our Instagram page and in other areas too. The question I always want to ask though, is there anything you think we've missed, Dr. Fish? Is there any aspect you think we might have missed from this?
No, I think we did a good broad overview. I think if people are always welcome any questions, I guess, after the fact, if people send them that way.
Absolutely.
For them.
Absolutely, and we can pass those questions on. As I said earlier, anybody who's looking for the link to the Spark study that we were talking about, I can post that in the comments section too. Thank you to everybody for all the questions, and absolutely, Dr. Fish, thank you so much for your time.
Of course, thank you.
Thank you very much. Everybody have a good rest of the morning and afternoon as well. Thank you.
Bye, guys.